Everyone, once again we are meeting on this beautiful Sunday evening with a new topic and to give you something new knowledge to my colleagues, to my gynec friends. So, today's topic we are coming with Institute of Cosmetic Aesthetic, Regenerative and Reconstructive Functional Research Center, that is short form is CARF. CARF is a transparent name in laser in cosmetic gynecology. So this is a very innovative approach and this is an introductory session in cosmetic gynecology. Approx 1 month back, we had taken a session on PRP in cosmetic gynec and we got a tremendous response, and many our colleagues doctor had joined and they are doing a good practice in that. So in that line we are coming with a new topic, that is laser in cosmetic gynec. Here we are coming with, because this is a totally a new branch. Fine. So like up to this, everyone we are knowing that this is restricted to the dermat, restricted to the skin specialist for the face and everything they are doing. But since 4 to 5 years, this branch is growing in a very slow, and in a few years it is like a fast growing branch. This is very good branch in the terms of no emergency, and we can fulfill and we can satisfy to the patients at patient and our convenience. So that's why this is a beautiful upgrowing branch in the gynec. Up to this, everyone are masters in high risk pregnancy, masters in laparoscopy, hysteroscopy, infertility treatment, opening the IVF centers. Now this is a new branch, that is the cosmetic gynec. So this is a second introductory session. One we had taken is PRP in cosmetic gynec. Second one is laser in cosmetic gynec. So this is a beautifully organized session, especially by Dr. GAURAV CHAVDA. He is master in cosmetic gynec and he will going to give a beautiful discussion on laser in cosmetic gynec. So me and all of you are learning from Dr. GAURAV CHAVDA. What are the lasers, what are the importance of the lasers, what is difference of the lasers that is used by the dermatologist, and what is difference that we used as a gynec. So what we are going to cover in today's session, so that we all must to know what we are going to give you in this introductory session. What is cosmetic gynec laser, how it is differ from dermat laser, history of cosmetic laser but not cosmetic gynec laser. So we are giving you a general history how the cosmetic laser has been innovated, mechanism of laser in general. If we want to learn, then we should able to know on what base the mechanism is going on, how the laser is working. Types of energy based device, that is EBD in general, in laser in gynec are generally known as EBD treatment, that is the energy based devices. How to do social media marketing for the cosmetic gynec laser practice and for routine gynec practice, because up to now we are only doing our routine gynec practice. So if we want to grow up this new branch, then definitely we have to tell the patient, we have to do the awareness, then and then only patient will come to us. Sometimes what happens, many patient comes to our OPD, they have the problem, but we never give importance to their complaint, like they having the sexual dysfunction, they having itching since long in the vagina. So like this, we never look into the vagina in the private parts of the female. But with this, we can inform the patient, we can guide the patient, and then we can create the awareness amongst the patient. ethics and the medico-legal aspects of the cosmetic gynec laser. That is very, very important. What are the ethics? It is not that every person is coming to our OPD will market to go for the cosmetic gynec, but there are some ethics are there, and we should be bound to are the medico-legal aspects before we can explain to the patient about the treatment. So welcome once again, welcoming all of you to this beautiful seminar on this Sunday evening. It's a totally free for all our gynec colleagues for the introduction of the new branch at your clinic. So this lecture is mainly going to be conducted by Dr. GAURAV CHAVDA. He has done MBBS from the BJ Medical College, Ahmedabad, MS OBGY from the NHL Medical College, Ahmedabad, MRCOG 1 London, UK. He is also the expert in the LLB medical legal expert. He has done fellowship in cosmetic gynec, Foxy fellow in the laparoscopy and the hysteroscopy. This is my self introduction. I am Dr. ALPA Chavda. I am the IVF and the surrogacy expert. I am MBBS and the MS from NHL Medical College. I had done diploma in RCOG Germany as for the embryology. I am doing working as an embryologist at my own center, that is MADHUDEEP IVF Center. So, what is it? Now, the Dr. GAURAV CHAVDA is going to come up with all the topics, and he will going to explain a beautiful way all the topics in detail. So, welcoming Dr. GAURAV CHAVDA on the dais, please.
So, thank you so much, Dr. ALPA Chavda, and once again, warm welcome all of you. And basically, today's lecture is on laser in cosmetic gynecology. And second thing, what is the importance of laser as a gynecologist? So let's start. Before starting laser and gynecology, we have to know what is aesthetic, what is cosmetic, what is regenerative, reconstructive, and functional. Lastly, all 5 words plus you have to join gynecology. So let's start with aesthetic. So as per dictionary explanation, aesthetic means whatever related to the beauty part. So that is meaning of aesthetic. Second thing, what is the cosmetic? When you added aesthetic with some medical function or some medical device or with medicine, it include as a cosmetic. Third is the regenerative. When you use PRP or a stem cell or exomers or autologous fat or somatic cell, it is termed as a regenerative medicine. Reconstructive belongs to plastic surgeon. If you have to made some surgery to make it way before, like if you have a problem in skin and you just applied a flap on it, it is a reconstructive or related to plastic surgery. And lastly is a functional. This is the very important word because all of them are incomplete. Like aesthetic are not including cosmetic, cosmetic is not including regenerative, or reconstructive is the different terminology. So basically functional. So any medicine, any machine, any device, any knowledge, any pathy which help in human any system to make is revert back to the function, that is known as a functional gynecology. So within second we will start once again. So that is the related to the aesthetic, cosmetic, regenerative, reconstructive and functional. I rapidly revise all the terms. Aesthetic related to the beauty part, cosmetic when beauty plus medicine or anything else, a regenerative related to the PRP stem cell, reconstructive related to plastic surgery, and functional anypathy, any science is helpful to regain, to refunction all the organ or the system. Like if you have a problem, atrophy in vagina, and you once again gain back to the normal vagina, it is known as a functional, as a physiological science. So when we started way back, it is the aesthetic gynecology, then after that it is the cosmetic gynecology, then added to the regenerative, then surgical part, reconstructive. Lastly today, at present we term as a functional gynecology. So friends, it's a 100% pure make in Bharat course. It's made by a Bharatiya gynecologist, me and my wife, and for learning a Bharatiya gynecologist who want to become expert or want to join or want to know regarding what is cosmetic or functional gynecology. So rest assured. Now question. What is the question? Question is that be aware of this webinar. We will discuss only cosmetic gynecological laser and not dermato laser, because this webinar, this course is related to the only cosmetic gynecological laser. So if anybody from other pathy or want to know other than gynecology, please forgive us. So because dermatological laser works on a skin and on a hair follicle. It is ablative or semi-ablative or non-ablative, and ablation always cause fibrosis. So what we discuss is a smooth laser or a non-ablative, which is work on vaginal mucosa. So that is the main thing. Cosmetic gynecological laser is a commonly known as an energy based device, is a part of EBD. So after this, whenever we like speak or discuss regarding the laser, we commonly known in our practice as a EBD, because it is a energy based device. Energy based device is including laser, radio frequency device, plasma, and HIFU, and also other magnetic device. So it is a commonly known as a EBD. So is equal to, is a part of EBD system. And like EBD laser in a other pathy, other branch are hot and not cold in nature. So some type of EBD are hot in nature. I have just present a symbol, but it is not in cold in nature. But as a gynecologist, we are a MS, MD, DGO, DNB, we are like MRCOG or any other certified gynec, know very well that vagina and urethra are not vegetables to cook. Once again, this is the principle. Vagina and urethra are not vegetables to cook. So what are different type of EBD and how they are work? So EBD is equal to laser. Laser is a part of EBD. So there is a golden principle that whenever you purchase or you start practice as a cosmetology, you purchase some EBD. So EBD or laser. So at that time there is a energy source or electrical current. So you applied your plug to the switch part. Then that electric current is passed into the energy based production device or EBD, and which produce energy or a production of a heat. When this heat is transferred from your probe inside vagina, so that creates some changes and it will work later on. So now start with general laser. What is general? Laser history. So I think all of us know very well the king of any radiation was Sir Albert Einstein. So he was king of this radiation or laser therapy. So way back about 1915 or 1950 up to this time, they make this type of advertisement. This is in about 1915. So they just like produce this ad: destroy unwanted hair forever. Temporary relief is not enough, only by killing the hair root. So this is a laser or like some device which was marketed by some person in 1915 in like USA. Now, what is the laser history? For that, there are two eras. First is from 1915 to 1950, which is Maser era, Maser, M-A-S-E-R. And from 1950 to 2024, it is a Ruby laser era, which was very much important. Now, okay, we know it is about 1915 to up to 2024 April, but before 1915 also there is a history. History goes beyond 1915. Africa, some of the tribes use a science of fire. It is known as a science of fire or concept of heat or thermolysis. What is the like principle behind it? They know, they like there is no hair on their body from genitalia to the chest or on hand. So they just create a heat, and when energy is developed, they just passed on it. So because of energy, the hair root are permanently destroyed and their skin without hair. So that is the like way back or like very old laser concept or old laser machine. Next, when we talk about the African laser, why it is not, there is a history of Indian history, like in Rati Rahasya, before also AD or DC, there is a Rati Rahasya and a Kama Sutra. Below thing are given. So what they think? That is the yoni stem. Yoni means vagina. So what are the benefit of the modern yoni stem and the older one? This is the older one concept of the yoni stem. So basically they kill the bacteria, helpful in vaginal dryness, postpartum period, or like there may be some type of tighten uterine muscles or vaginal itch, or everything may be like as per their concept on those days. Now this is a paper present for Rati Rahasya or Kama Sutra, which was like presented way back, and this is the documented evidence that in Indian history also they use yoni stem or like a very past laser system. This is all about the history. This is the documented like Sanskrit laser system in Rati Rahasya. I know very well that you can't see properly, but because it is very like old paper, so that's why it is like some blur. Okay. When we discussed about Indian and African, now it's also to the Greek and also some of the Muslim countries. They also use this laser type of thing for rejuvenation before so many years. So now start with the 1915 to 1950 era, which is known as a Maser era, M-A-S-E-R. So what is Maser? Maser stands for microwave amplification by stimulation emission of the radiation. The first maser made of the ammonia was invented by Towns. The proper name is Charles H. Towns. So Towns made first maser type of device with the help of ammonia. So it is known as a measure made by the ammonia. The maker is Towns. Modern measures can be designed to generate electromagnetic waves at microwave frequency. The frequency is very important. Microwave frequency with radio and infrared frequencies. So this is Towns, and with his first measure machine with ammonia. But laser which invented after 1950. So what is the principle? The laser works by the same principles as the measure but produces higher frequency. The frequency is a game changing thing. Coherent radiation at a visible wavelength. So this frequency basically at the visible wavelength. That is the main thing, visible wavelengths. First laser was built in 1960 by Theodore Harold Mayman. So Theodore was the first laser invented in 1960. So this is a Theodore Mayman, born in USA, California, Los Angeles, and died in 2007 in Vancouver, British Columbia in Canada. And like alma mater is University of Colorado, and first inventing the ruby laser. The name of that laser was a ruby laser. So now everyone know Uri movies and they use this type of beam. So we have concept from that what is the full form of laser. Now just forget measure era. Well, I think we can't use this in nowadays. So it is the laser. So what is the laser? What is the full form of laser? The laser stands for light amplification. We amplified the light by stimulated emission of the radiation. When light is amplified by stimulation rays, stimulated emission of the radiation, we create a laser beam. So that is the definition of laser. We have to know what is the full form of laser. Light amplification by stimulation emission of the radiation. So first Theodore's ruby laser is this type of device. This is the concept of what is the ruby laser, how a laser work. Some of the like point is given to here, but because of too old we cannot properly identify. So now let's start modern laser mechanism. Modern laser mechanism. So in a laser, you know there is a pipe or like tube in which you have injected a medium. When we give or pumping energy in the form of electric power is thus thrust again medium. So this medium have excited photon and this is the two mirror. So when you give the energy, it passes through this medium and medium containing the photon which like in contact with the first mirror and second mirror, first mirror and the second mirror, and that excited photon release some type of energy in the waveform and which create a laser beam. This is the laser beam. Once again, this is the part 1, energy given. This is the part 2, gaining media or instrument EBD. When you give the power, the media containing each excited is photon is excited and go higher like frequency, and they produce a wavelength which when like stuck with the first mirror and second mirror, some of the wave is passing through it. It is a semi lucent media, so it is passing through it and make a wave like a beam which is called as a laser beam. So that is the basic principle, and for that we have required partially reflecting mirrors and totally reflecting medium. So energy, media, give the energy, excited photon producing the wavelength, heated to the totally reflecting, and partially reflecting mirror and creating a laser beam. So I think if you don't know this one, this is the basic principle which every gynec must understand, and then we can proceed to the main function of the laser. So this is a like pictorial presentation. What is the component? So first is the energy medium, second is a first is the energy electric power. It is a medium for the laser. It may be a CO2, it may be ND YAG, erbium YAG, diode laser or whatsoever, and then produce the photon wavelength reflecting on the reflective mirror, and from partially reflective mirror, and then there is a laser beam is created. So that is the main principle behind the laser, and I think very minimum doctor know this principle. If we joining more than 300, we know only 3 to 4%. What is the basic principle? Because it's only a like laser company which just taught us all this type of principle. Now what is level, atomic level, the mechanism action for the laser? When you give energy for the containing media, there is a photon. It is in like basic orbit. When you give energy, it excited and go upper side like their orbit, and during this time they produce typical wavelength, and this wavelength useful for the laser. Second thing, when you give energy in laser, create same type of coherent laser waves which also helpful. This is the atomic level presentation or mechanism of the laser. But don't worry, as I have to prepare this lecture, so I go this depth like 100% depth. If you don't remember or don't understand, it's okay. If you don't understand, partially understand, please call us. We can also explain if you are interested in physics. Okay. Now next one, and remember, we are a gynecologist, we are not the physicist, so it's okay if you know very well. Now as we know, Theodore sir has developed first laser, name is a ruby laser. So what are the like important, what is the help of ruby laser? Ruby laser was used extensively in tattoo and hair removal, but nowadays it is replaced by alexandrite and ND-YAG laser. Now next thing, we are very well known in dermatology, there is a IPL and there is a laser. What is the meaning of IPL? IPL mean intense pulse light, and laser, how it differ? So this is the picture presentation of laser and IPL. IPL have discrete wave and laser is a concentrated only one beam. This is the difference of IPL and laser, not is in gyne. So what is the basic difference? Laser have a monochromatic light, single directional and coherent, where area ordinary light has a not a monochromatic, it is a polychromatic. It may be a not directional, unidirectional, and have a not a coherent wavelength. So this is difference between the IPL and laser. Okay. So once again, I have shown you what is the IPL and laser and how its work in the laser. It is the important of the wavelength and the power joule is important. Okay. So once again, what is difference between the routine light and between laser? It is once again the directivity, monochromaticity and coherence. It is direction is single in laser, like it is a monochromatic, and it is work in a coherence way. So this is the three principle. It is important. It must be learned by a gynecologist. This thing. Next, what is the important of which are the terminology which is used for gynecologists? We very well know there is a specific wavelength which is created by the laser, and it affect typical part of the tissue. It may be a plant,
it may be a human, it may be a animal. So two very important thing. One is the wavelength and second in the like which type of tissue. So after that, if you like forget all previous slide and my lecture, it's okay. But now we come to the point from where applied clinic part is start. So you have to know a wavelength of the laser. So whenever you purchase any laser, it may be a dermat, cosmetic, aesthetic or gynec, you have to know what is the wavelength. And second, what is the power, what is the joule. Joule is very important. So there is a watt, how much watt you given for what period of time, and what is the sport size. This is the sport size, you know, this is the sport size, this all the sport size, laser sport size and bigger sport size. Also there is the depth, you have to know, this is the depth. So these are the some of the like terminology. As we know, in IVF we are telling that ovum pickup, embryo transfer, we are like giving the trigger. In the same way, this is the new field. So this is the some of the important terminology. But don't worry, if you don't know, it's okay. Now come to the point. As we know, laser have a different wavelength which work on the different tissue. So there are some classification of the laser with a wavelength. So start with first of all ruby. It is like 694 nanometer wavelength. Then alexandrite, it is a 755 nanometer. Then andiag is a 1064. Then erbium YAG, it is the 2940, and CO2 highest wavelength is a 1600. Okay, and below the ruby laser it is the dye laser or KTP 532, argon it is a 488, and excimer it is a 190. So this is the different wavelength. We have only remembered the wavelength which is useful for laser. Okay. So now come to the point, how laser work in construction and not for destruction. Nowadays in army also they use the laser for destruction, for target targeted make some bomb or etc. But here we useful as a reconstructive part or EBD part. So a laser generates a beam of light in a certain wavelength. Wavelength is very much important. Laser light has a three special characteristics: monochromatic, coherent and collimated. When you know this, now then we like come to the human part. The laser beams travel in a parallel path to each other. Laser works to deliver light into the skin or epithelium or mucosa, which is then attracted in certain chromophore. So it is the part 3. First part is electricity, second is EBD, and now come to the human part. So it is the certain chromophore in a human being. So you just question now, what is the chromophore? Yes, important part for laser is a wavelength. Now come to the human part, it is the chromophore. So what is the chromophore? It is a very important part for the human being. It is a characteristic of the skin such as a melanin, dark pigment, hemoglobin, redness in the blood and water. Other than these three, melanin, hemoglobin and water, there is the fat, there is the tattoo and some other color. This color is work as a chromophore. So these chromophore are the targeted point in the body which affected or targeted by the wavelength of the laser. Say for example, if we have a 1470 nanometer, it's a diode, then it's affect only the water part of the body. So it's most helpful in vagina. So same way, if we have a KTP, then it's affected the hemoglobin. So it may be useful in piles or DVT, any vein problem. So now let's continue. The laser energy of a certain wavelength is then delivered to the structure selectively and precisely, minimizing and damage to the surrounding tissue. When we like fire 140 wavelength of the laser is affect only a water part. When the light is delivered to certain chromophore, it destroys something we call selective photothermolysis. Way back, Africans use this type of for remove the hair, but we have now developed the instrument which is selective in nature to destroy only selective, minimal, precious part of the body. When we destroy it with the wavelength, so what happened? There is a photothermolysis. So in the simplest of the term, a laser treats a skin by removing particular target. It is the wavelength of the, this is the most important like line of this lecture. I repeat, it is the wavelength of the laser and the chromophore of the body, that wavelength is attract to determines what skin condition or mucosa or epithelial part of the body particularly laser treats. So that is the basic thing. It is the wavelength of the laser, which wavelength we are just fired, and which type of chromophore of the body affected by this wavelength, particular that type of disease or particular that type of beauty or that type of cosmetic or like reconstructive part or surgery, we can do it. Okay. So that is the principle behind the laser. This is a secret. Commonly, targeted chromophores are hemoglobin, as we know when vascular lesion are being treated, melanin in pigmented lesion, and water targeted to the skin peeling that result in collagen remodeling. Ink like dye or tattoo is exogenous chromophore targeted during laser treatment to remove tattoos. So my dear friends, this is the first part we just completed. Now this is the same thing explained different way, but the basic principle is what is wavelength, what is the chromophore. It is a tricky business. Now once again, what is the wavelength of melanin? It is a 1064. Okay, so it is a 500 to 1064 nanometer, and which is useful for the hair removal. Now it is a hemoglobin. The wavelength is basically used for remove any scar or rosacea or broken blood vessels. Now it is the water, which is the most important part as a gynecologist, as a cosmetic gynecology, as a laser gynecologist or laser expert. Water is the most important. It is a chromophore, and it is the 1470 nanometer, which is the wavelength used. Which type of laser which created the 1470 nanometer, it is very useful for our like body, and which is useful in the vagina. And after all, we know that 80% of our skin is water. Okay. So when we targeted this type of tissue with the transvaginal probe, we can create a tightening, we can create a helpful in SUI and some other disease also. So that is the water part or a water chromophore with a 1470 nanometer is very important of laser. Now tattoos, I think we are not like discuss more on this part because we are only concerned regarding the cosmetic gynecology. Basically for tattoo removal you have to require the Q switch or pico nano laser. Now fat is also important. So water and fat part of the chromosome is very much important. In a fat, why we require? Because in female we also require the body contouring or sculpting. You must note down these two words, body contouring or sculpting, as a laser consultant or a cosmetic gynecologist. So please note down 4 words in your book. First is a which type of wavelength. Second, which type of body chromophores like water or like fat. And third one, you have to note down a body contouring and sculpting. That is the main 4 words. So at the end of lecture, you have to just revise that what is the importance of laser part, or am I be a good laser person, or like somebody fool me during my purchasing or after practice. So once again, a different way. Chromophore helpful to like producing some type of mechanism to destroy body's certain condition. So in a simple way, nature also produce laser-like function. You just see, this is the source, sun, this is the organ which is the leaf. So, when there is light of blue, red and green, these two light are absorbed by the leaf, but a green light is not absorbed by the leaf, so it travels back and we can see on our eyes. So, that is the also principle of laser. Now, which are the basic chromophores and which is the wavelength? So, it is a graphical presentation: hemoglobin, melanin and water. When we go in depth after this series, a lecture on 2 or lecture on 3 or 4 or specific laser, at that time this graph is very helpful. You know, it is the absorption and this is the wavelength. Okay, so this is the hemoglobin wavelength, melanin and water. Now, when we know the wavelength and chromophore, one other thing is also important for the laser, for general in laser, it is the depth of the laser. So, this is a different name of the laser: KTP, PDL, ruby, alexandrite, diode, Nd:YAG, and this is the layer of the skin or vagina. It is stratum corneum in the skin, epidermis, and this is the depth: stratum corneum, epidermis, dermis and dermal vessels. So, this is the wavelength and this is the depth, like KTP only work to the epidermis, PDL up to the dermis. After that, ruby, alexandrite, diode, Nd all are affected up to the vessels penetrated. The depth is more in this type of laser. So, now come to the point. We have just know what is the aesthetic, then cosmetic, regenerative, reconstructive and lastly it is a functional gynecology. Now, we also know the history. Father, first laser, what is different between major and laser, what is the basic important terms, it is the wavelength. In body, it is the chromophores and how it works, what are different type of chromophores useful. In gynec, the only two chromophores useful, first is a water, second is a tattoo. First is a water and second is a fat. So, this is the two basic chromophores which require to helpful to produce some effect in the laser gynecology. Now, come to the what are different type of laser available in commercial market. It is just I want to clarify that it is for generalized laser. It may be a dermat laser or aesthetic laser or gynec combined. It is not specifically about gynec. It is generalized laser, type of laser. We just start it. Yes. Now, for the first time up to this, you know everything very well. But now it is the confusing. Just remember, and also it is the fun part. I have clarified wavelength, chromophores and what is the important chromophores for the gynec. But now the type of laser which is almost 90 to 99% confusing and also it is the fun part. So, let us see what is the fun. First, it is important to remember that due to the lasers being a single wavelength, they are the best suited to treating different condition. One laser is not the be all and all for the all condition. Single wavelength, single chromophore, single condition. Repeat, single wavelength, single chromophore, single condition. If you don't remember that, then anybody come and just said it is a triple laser, but I think it is a wave likes. It is a wave like, it is a mimics, so it cannot be possible. Okay. Now, first of all, KTP. So, as a gynec, I think I never been use this type of laser, but just for your general knowledge, KTP is a potassium titanyl phosphate. It is a wavelength is a 532 nanometer and it is a solid one. And basically, they are related to the vascular laser. Second is a pulse dye laser. We also as a gynec not use this PDL also. The wavelength is 577 to the 585 and basically they are useful for the deep vascular problems. Ruby laser, Theodore's laser or the first laser, wavelength is 694 and it is a red ruby crystal. It is the red we have fantasized with the green and red color of the laser. So they use the red ruby laser, and I think used for the hair and laser reduction also and tattoo removal. Now it is the alexandrite. When you come to any dermatologist or aesthetic, they call we have a good alexandrite. So alexandrite's wavelength is 755 nanometers and basically useful for the skin and the hair follicle. It's a diode laser. Diode laser is very helpful in gynec condition because diode have a both type of property. It is the ablative and non-ablative. Now you are confusing. What is the ablation and non-ablation? Ablation means it is a cutting, and when there is cutting, always fibrosis present. Remember, these are the principle. When there is the ablation, there is always cutting. When there is cutting, always fibrosis present. And in vagina, we don't desire to make a fibrosis. So it's okay, but there are some difference use also. Like we want to use in a resection of the septum in the inside the uterus. At that time we can also use. In case of anal part, some tag is present, you can also useful. In some fibroid removing also, we want to precious initiation. At some times we use ablative lasers. So that is the useful. The wavelength is generally 800 to 900 meters. Now Nd:YAG, neodymium, yttrium, aluminum, garnet. So basically this is the all description. If you are interested to start a practice as a gynecologic laser consultant, and with that you also want to add aesthetic or cosmetic, then this is useful. You can go this through. But as first of all, in first slide I have warned all of you that be cautious, is only for a gynec, but it is general, like some of the tips of what is Nd:YAG. Now it is a erbium, yttrium, aluminum, garnet. It is very useful in gynec laser. So we are also used as a smooth laser in case of some vaginal tightening and SUI. So this is a very useful laser in gynec. The wavelength is a 2940 nanometer, and as a dermat, they are helpful in the collagen formation and also in wrinkles and scars and textural problems. So basically CO2 laser, diode laser and erbium YAG laser are very useful in the gynec practice. But because today we are only discuss to generalize practice of laser, so these are all the types of laser. Now is a CO2 laser, and the history start from this point as a laser gynecologist consultant, because as I know in 2012 first laser from American company which promote CO2 laser, name is a FemLift. You can remember FemLift. Nowadays also this term with some like old market representative come to you for like purchase of the FemLift. It is a CO2 laser, but is a ablative in nature. So remember, vagina and urethra are not a vegetable to cook it. So it's enough for me to inform or hint you that what is the problem created by the ablative CO2 laser in FemLift device. So that is the thing. But nowadays very like smooth laser which contain the CO2 as a medium are also coming. So you can also advise to start practice with cost of the CO2 laser is very reasonable. So you can start with CO2, then switch over to the diode laser, and then you can also go to the erbium or combined laser, mixed laser you can also use. So that is the main thing about CO2 laser, and this is the brief like information about the laser. Now come to the point, what is the ablative and non-ablative? So laser have a nature in the form of ablation or a non-ablation. So now as I know, because as continuously I am speaking for more than half an hour, I am tired, so I think you are also tired. So we will take a 5-minute breaks, and within 5 minutes we once again start with very interesting topic, because picture to abhi baki hai. This is all the like numbers, and now we are come to the mainstream with CO2 laser. So we will meet immediately within 2 minutes, and I will like change the slide. up to the CO2 laser. You can go through it, you can take some tea or water, and within 2 to 3 minutes we once again like join the session. Now I promise, if you attend this lecture, you 100% guaranteed that you will start your laser journey as a gynecologist. Hello, hello, yes, yes, yes. If you properly like can hear my voice, then please type yes in your chat comment, so we can like proceed to the other side. I am waiting for a reply. હવે તો મને કહેજે. Yes. So now we interrupted at the CO2 laser. So explain once again repeatedly, repeat all the points of this lecture. Fast forward. Okay. So first point, what is the aesthetic? It is a little beauty. Cosmetic, when you added aesthetic to the beauty part, like a medical part, it is the called cosmetic. Third is the regenerative. When you add the PRP or like some stem cell, anything, it is like called regenerative. When you add surgical part or plastic part, is called the reconstructive. And last one, what is the functional part? Is the functional is related to the all the functionality of the body, and particularly for the gynec part. Second one, who is the inventor? Like Theodore is the first ruby laser inventor. What is the important part of laser? It is the three part: electric part, body part, and what is the effect on the body. You can pass it to the electric point, and electric power is passed to the that device. Device contain the media, and medium passing through the photon, and it specifically generate a specific wavelength, which is important because some have a 500, some have a 1000, some have a 10,000, but specific wavelength is required for specific disease. And when this specific wavelength it heated to the specific part of the body, which is known as a chromophore. Basically there are 5 type of chromophore. First is a melanin, hemoglobin, water, fat, and tattoo. But as a gynecology, I know only, and I want to like inform you only 2 part. First is a water part for vagina. Second is the fat part for body contouring and sculpting. And other than this, there is a specific depth is required for like to work this laser. And other than this, now we are discussing regarding the type of laser in which as a gynec I came across in 2012 as a CO2 laser, which is the first laser as a FemiLift. Second is a diode laser. Third is the erbium YAG laser. This is the specific wavelength, specific effect. But now company come with like CO2 with erbium or CO2 with diode. These are like other the type of combination are also available. Let's see. After CO2, now just before I just talk regarding two terminologies, ablative or non-ablative. Ablating pertaining to the cutting of the tissue, and when there is a cutting, always there is a fibrosis present. So nowadays, as a cosmetic gynecology and working for a vagina and vulva, and also for the urethra, we are not supposed to advise to use a ablative laser. But in gynec also there is specific requirement for the ablation, like in case of you are doing hysteroscopy or you want to remove some tissue, a tag, or like you have to done the laser labial plasty. At that time you can for precision your incision you can also use that one. Okay. So ablative. So what is the ablative? In nutshell, ablative laser work to remove the top layer of the skin epidermis. Example, for these are the CO2 and erbium YAG lasers. They are resurfacing lasers which treat photo damage, deep lines and wrinkles, early skin cancers, scarring and texture changes. So, this is the difference between the laser ablative, non-ablative, ablative for cutting, non-ablative for the smooth laser. And you must remember, non-ablative lasers do not remove any skin. They work to heat the skin below, treat particular skin conditions such as the vessel and pigment, and stimulate collagen and elastin resurfacing. I think you have repeatedly heard about the collagen synthesis and elastin resurfacing, and also in newer like very specific laser you can also stimulate to generate a nerve fibers which are very important for the vaginal rejuvenation. So, in nutshell, we know that we have require non-ablative smooth laser. Last thing, a type of laser also including the fractionate laser, and typically for CO2 in gynec it is a fractionate CO2 laser. So, first of all I want to show you one slide. What is different? You can easily understand by this one. Yes, this is a slide. So, what is the ablative fractional laser? When you applied like laser in the form of ablation, it creates this type of wound. But in case of ablative fractionate laser, this creates this type of wound. Same manner. There is a ablation, normal tissue, ablation, normal tissue. So, I think fractionate ablative laser is more helpful than ablation in case of gynec condition. So, what is the meaning of, you understand properly by this figure that what is a fractionate CO2 laser. It is a fractionate is simply a brand of laser. In the same way, Nike is a brand of shoes for your shoes. Shoes is always shoes. Biscuit is always biscuit. But you eat Britannia biscuit, Parle biscuit, same way. You like wear shoes of Nike. It was one of the first laser release which utilized fractionated technology, which is why it is so well known. Fractionate laser are used multiple narrow beams of laser lights to penetrate the skin while leaving healthy, untreated skin around the channels. By targeting only section of the skin at the time, the downtime is less and less tissue is damaged. However, results are almost comparable to the full field treatment. So, there is a two terminology now come across with us. There is the what is the thermal resting time and second is a downtime. So it's okay, but ablative have a laser tissue or vaginal epithelium or mucosa damage. Okay, the most popular fractionate laser is actually a dual wavelength laser and is non-ablative. It is a 1927 1150. Fractionate also has an ablative CO2 laser. Again, clients may not actually know what fractionate they are getting. So it is like market gimmicks. So client also don't know that what is type of like fractionate laser or ablative, but it's our responsibility to know. The fractionate dual laser is a 1927 nanometer wavelength and 1500 wavelengths. Is a non-ablative, and the fractionate repair 1600 is a ablative, meaning they are very different treatment with different outcomes. Okay. Now remember not to get caught up in brand names. So market have so many imported and in country made laser with different brand names. So don't cut up with brand names. Many other lasers utilize fractionate technology. Many of the new ablative CO2 and erbium ablative laser are fractionated, meaning less downtime, less risk of the complication and the comparable result. So now we come to know what is the downtime. So it is the new terminology after this sculpting and body contouring. So what is meaning of downtime? It is the time required to recovery from any procedure. Like if you doing the cesarean section, it require 8 days to healing of the scar. It may be vary from patient to patient and condition, but generally 7 to 8 days. I also now not doing the routine gynec practice with my wife, but as we have done some of the cesarean in before 10 years, at that time we usually advise patient to come after 7 to 8 days, and in case of like some complication we always remove step by step suture. In the same way, it is the 7 to 8 day downtime for any cesarean section scar. Same way in laser, it is a miracle. If you are just advise patient to do a laser and within 10 minutes you are getting a result. Like if you want to do vaginal tightening, you patient can feel after 10 minutes of laser therapy, it is a downtime for that vaginal tightening or vaginal rejuvenation. In case SUI, you use the radio frequency device and immediately result are seen because there is a edema produced by the radio frequency. There is a downtime is very less or like it is almost zero for any procedure in the EBD device or energy bed device. Okay. So what is the micro or histological level of the mechanism for the laser? As we know, there is a specific wavelength, specific chromophore. But now come to the point as a gynecology, what is the thing we desire in patient to treat vaginal rejuvenation or in case of vaginal tightening? So that is the collagen. These treatments result in collagen remodeling and stimulation, resulting in a reduction in the photo damage, wrinkles, pigmentation, texture changes and overall healthy glow. So this is the collagen, elastin remodeling and the nerve stimulation and some vessel stimulation. These are the main desirable effect of the laser in gynecology. And which a laser downtime is also desirable. So I have previously shown this slide that ablative a big wound and non-ablative fractional, ablative fractional result is a less wound with a intermittent good tissue. Now I want to tell you what is the TRT, tissue resting time. So laser have only a single principle. You applied energy of specific wavelength for a specific period and there is a gap of no energy, then once again there is episode of the specific wavelength, energy, then gap. So there is a time between two wavelength. This time is known as a tissue resting time, which is very much important in past. As we know, when we give to some energy to the some part, it creates the heat. So it may lead to the burns or it may cook our vagina or urethra, but we don't desire that thing. So at that time there is a specific gap between two energy point. So this point is a cooling or resting point. It is different for different type of laser and is specific for that laser. So when there is a specific TRT, there may be less chances of the tissue damage, but it is a company claim. Nowadays, as per Cochrane study, this principle has already vanished and they denied for the TRT. But it is important to know what is TRT. Now downtime, that already I have explained that the time to recovery from any device or any procedure, it is a very low or up to the almost 0 or 1 or 10 minutes in case of EBD. It is claimed by some company, but it is useful. So, let us start with our main topic. It is the laser in cosmetic gynecology. So, previous all slide are like called as a trailer. Now the main picture is start. So, movie तो अभी चालू हुआ है, पहले वाला तो ट्रेलर था. This all for generalized person as a laser consultant, aesthetic or like cosmetic. Now just we enter inside the laser cosmetic gynecology. So, which are our character, which are our hero? So, these are some of the heroes. These are known as the energy based device, as already explained, EBDs. So, there are basically 1, 2, 3, 4, 5 and 6 main character. First is the laser. It is diode laser, CO2 laser, erbium YAG laser or a mixed laser. This is a energy based device which we can use in gynec practice. Second is a radio frequency device, which is last one. Third is very useful, which is HIFU, which is ultrasound, high intensity focus ultrasound, which is HIFU. Fifth one is a magnetic device, high intensity focus electromagnetic technology. I don't want to take a name of this word. You can take because company claim or shoe on me. So that's why is a high intensity focus electromagnetic technology. These two you can very well read or readable. So you can understand this. And fifth one is a carboxy therapy. That much not useful. And latest, a new release is a plasma therapy or called as a jet plasma HER2. It is a Slovenian technology patented for 2027 or I think more than that, in which they use a different principle for EBD. So, these are the all main. First is a laser, and I want to warn you that as a gynec, most of us only know the laser, but there are so many other devices are also available. It is a laser, radio frequency device, HIFU, HIFM, carboxy therapy, plasma therapy, all are the main character or the main part of these ABD devices. So, you can understand, and we go reschedule. In our next series, in our workshop, we also discuss individual every topic in detail. So, you will be master for laser therapy in cosmetic gynec. You can also yourself decide which type of instrument require, in which lesion, and what percentage success I will get and become a super laser cosmetic gynecologist in your area. Like it may be a north, it may be a west, it may be south, or you are outside of India, like in Arabian country or like in Asian country, or you may be from Europe or America, I don't know. But this is the final instrument available on this date. It is the 20th April 2024. You know everyone, and the one thing is more available is the plasma. It is called jet plasma HER2 device. So these are the most common devices available. Now this is the all the instrument with their commercial name, with the company name. Just go through it. Energy based device technology available for the female genital cosmetic surgery. So let's start with the radio frequency device. It is first, which is a Thermiva. Most commonly you know it is the Thermiva. So Thermiva is most popular name as a company name, as a commercial name. You can my photograph also take and some videos, so we can also send to our respected doctors. Okay, so that is the Thermiva. It is a radio frequency device, very useful, very successful device, but I am not the company person. But as per my opinion, Thermiva is nowadays very popular thing. This is a YV, is also very useful. Then it is the BTL. BTL is easily available in India, that is the Ultra Femi. Then in mode with Votiva. Votiva is also commonly used instrument in nowadays. Then it is a Venus concept, I know it very well. Now come to the Photona. In the laser industry, Photona, In Mode are very popular name. It is a very like giant company from foreign or abroad. So very popular model is a Intimales or Petite Lady, Juliet and Eva. These are all the different new company. Now come to the fractionate CO2 laser. As you know, Femilift from Alma company. So I want to once again clarify, if you want to eat a biscuit, it may be a Parle-G, it may be a Britannia, or if you want to wear a good shoes, it may be Nike or Skechers, same way. These are the laser, but company name is a Alma, product is a Femilift. This is the first CO2 laser. Nowadays, very smooth laser, very effective and very popular is the Mona Lisa Touch. It is a Deca laser, hologenic or Cynosure. This is available. Then there is intermediates which come with the Gynalase. Then Silent Touch with Harpemion, CO2 Intima, and last is a Fumina. And some of the like hybrid fractionate laser also available like Diva. So most popular one is the Thermiva for radio frequency, then Votiva for in mode, then Photoma, Intimales, then Eva, then there is a CO2 fractionate laser is a Femilift Alma, and Mona Lisa smooth laser as a form of Deca laser. This also, and nowadays hybrid fractionate laser, Diva laser. So these are the popular brand. Don't worry, we will discuss this later on in details. What is the their cost, what is the way of action, what are the main like point indication to use different type of this one, but just introduce this number. Okay. So with some pictures, as we are very fond of pictures, so this is a basically CO2 laser. It is only a picture representation. It may be vary from company to company or person to person. This is a CO2 laser. This is a magnetic device for a muscle pelvic floor like strengthening. This is a ultrasonic device for like produce the heavy energy or body sculpting or remodeling. This is the carboxytherapy to remove the below eye blackening and wrinkles, and also for revitalization or rejuvenation in some part of the Germany and Israel. This is very much famous, and also in European country. They have a bath like structure. This is not injectable, it is a like special device to release CO2, and it may be helpful. This is a radio frequency device. Because of copy claim and like bigger shoes, I have not used proper name or proper photograph. It is this photographic representation of all the devices. So આપણે આને રન કરીશું, આ વિડિયો છે. So I want to show electromagnetic device how it works. Let's see if possible. હજી પાછળ. હા. So let's see. Okay. So this is an electromagnetic device specifically called the chair, which is useful to generate 2 Tesla of magnetic field, which is very helpful for SUI and also in chronic backache. And in female you can also use it as a in a male also you can erectile dysfunction. So this is the Tesla chair and very useful. It is a mechanism how it works. It has a 2 probe, one in the buttock area, one on the back side, and if you require, now Tesla person also make one another probe on the below the foot, and also some specific like probe on the abdomen to body contouring. So that is the all thing about the electromagnetic device? It's okay. So this is the mechanism how the Tesla and the MCLA chair are work. But remember, don't ever tell if you don't have a Tesla or MCLA, otherwise the company person can sue a huge amount of like a claim. So just tell we have electromagnetic device. Okay, next slide kar dijiye. Okay, so now be specific for the gynec. So for a gynec, we have any balance slides. So the gynec person, there are so many effects of the laser beam and heat generated from them, but specifically we know there are different effects: angioneogenesis, then collagen production, then muscle regeneration, then cartilage production, then nerve regeneration, then inflammation of edema and bone formation. But my dear friends, as a gynecology, we only require 4 effects. First is a collagen production. Second is a elastin remodeling. This is the most common 2 things which is required for as a gynecology in SUR or the vaginal accessory. Third is a muscle regeneration, and fourth one is a nerve regeneration to get satisfaction for intimacy or like inflammation and edema. So that is the most common 4 to 5 effect of laser in cosmetic gynecology. In between, my dear friend, if you have any question or you don't understand any slide properly, you can also write down in chat box so we can repeat, or like we once again revision of their slide, or if you have any like any confusing or doubt, you can also write down. Madam, can you check any question is there? Okay. So now let's go once again. So what are the effect on the tissue? So we know it's the collagen, or it's the elastic remodeling, or nerve ending generation, or edema and inflammation. So these are 4 to 5 desirable effect of the collagen of the this laser or EBD device in vaginal rejuvenation. So let's see. Vulvovaginal rejuvenation by resurfacing reepithelization. First effect. Second, neocollagenesis. Neocollagenesis. Third one is a neoangiogenesis. And a fourth one is the stimulation of the growth factors and healing cascades. So these are the 4 to 5. And one thing is more, now also some research is going on regarding the nerve ending also generation. So it is also most common effect of this laser. Now what are the, now we completed till date what is the aesthetic, regenerative, cosmetic, reconstructive and functional gynecology, what is the history, what is the mechanism action of the laser, and what is the type of different type of laser in general but not in specific. And then we discuss what are the different type of EBDs, energy based devices available in gynec. We have also named some newer one, and then we come to the main part, what is the desirable effect of the laser or EBD device in gynecology. Now come to the some of the point. When you are not choose proper instrument, you are influenced by the industry driven some instrument, or you are claiming some false thing, at that time what happened? See, some complication and side effect and medical legal issue. And as a LLB person, medical legal person, I always also like also want to discuss regarding some this type of pointing, because it's not important. As a gynec, till this age, I just go through with my wife that what you supposed to not do. It is important what you must not do or you should not do, then what you should do or you must do. The important thing is what you supposed to not do, because complication, this is a newer field, it is the science of future. Though we have so many study, but even today we cannot claim it is 100% safe. And if you are not using the right way in protocol, so you may create some disaster in ending point. So let's do, because I always tell vagina and urethra is not vegetables. So you don't even try to cook it. So most effective instrument, proper time, proper energy, proper wavelengths, and with brain which type of like you effect you desire. So that is going on. So if you are not using the proper way, you end up with complication and medical legal issues, which is known as the shoes. Redness, swelling, peeling, mild outbreaks of pimples and acne, crusting and oozing. Some more serious risk, if you are not end till this point, if you want to become a hero or superhero, then let's see what happened. Post inflammation, hyperpigmentation, properly known as the in this field PIH. As a gynec, we know only pregnancy induced hypertension, but this is newer one, newer terminology, PIH, post inflammatory hyperpigmentation. Patient come with complaining, I have PIH. So at that time, don't even think regarding the pregnancy induced hypertension. You are trouble with this one. Now post inflammatory hypopigmentation. So that is the post inflammatory, you may be hyper or hypopigmentation.
Is there any consent required when we do this procedure?
Yeah, definitely.
For this adverse
So there is a very beautiful question and very intelligent question, that is there any consent required in this field? It is a most probably patient driven fields. So patient, now one thing I want to clear, that in this field there is no patient, there is always client. So you must first clear yourself as a like giving something as a consumer and seller. So whenever some like client is come to you with some desirable effect they want, at that time you first show where he or she or in between part there may be a some they what stage, like some patient come with you that I have a loose vagina or I leak, I am leaking. So at that time, first of all, in this laser or like cosmetic industry, you have to properly counseling patient. Counseling is a very most important part in this. Though you don't require psychiatrist or counselor, you just go through all the proper way channel. And second thing, you have to tell patient patient that if you are allowed, I have to take some photographs of our private parts, even though I am not uploading or showing to any person or in my OPD or anything, but I have to take some photograph of your private parts, because this part is always hidden, and so that's why patient is sometime there may be a shame about regarding this. So you must take photograph or photographic consent and you show that you are coming with this complaint, this is the photograph, this is the video, and I assure you that and rest assured that I will not like update or anything or like show any publish this in the any journals or etc. And at that time you must take consent, and consent in the form of pictorial, in the form of photo, in the form of video is must. And after that, when the procedure is completed and end result also you have to show at the immediately at the like follow up day and 15 days and up to the 1 years, because most this all the procedure you have to repeat it, and you must counsel patient that this is not a permanent effect. As per example, when we go to like your facial in a aesthetic branch or in beauty parlor, simply not a medical part, they always tell that yes we have done, but because of the degeneration you have to come after 1 month or 2 months. So same way you have to tell it is not permanent one, I just try, and up to 70 to 90%, most probably studies show that 70% or 90% or 99%, whatever the percentage of the indication will be effect on your private parts, and if it like vanish, you have to come. So that is the basic thing. You have to prepare patient for more visiting, or you have to give the package of that 6 time you have to come or 8 time, whatever the company protocols or machine protocol, or you own develop your protocols, and rest assured in every lecture, after this lecture we create a separate CO2 laser machine, their mechanism, they are useful in the gynecology application, then what is the most desirable effect the CO2, some part like vaginal or like skin, and then we also give the protocol, their consumer or their industrial person number, and which is the like verified machine are available. It may be a foreign or Indian, we give all the numbers. So rest assured, don't worry, all things are ready, because since 2012 we are dealing with branch. So in between, just I want to tell you how we are come across this branch, because in 2012 me and Dr. ALPA has just started a new branch which is called as a, at that time, stem cell, but because of some government restriction we changed to the name to its autologous cell therapy or mesenchymal stem therapy. At that time we established two companies. First is a like Magic Stem Cell, and second is a Stem Cell Express, and we both are like a proprietor of this company, and we are starting since 2012, when even in India most which are the very influenced people also don't know that in PRP. At that time 2012 we start the PRP, then after we go through the FAT, autosomal FAT therapy in the form of stem cell, and then we start the mesenchymal stem cell therapy, and we since those days we are claiming that PRP is very effective in infertility, in endometrial thickness, and on some part of other like in the knee pain or etc., and on the in the skin person also at that time newer to this one. Since those days we are trying, we have been trying for this, all the regenerative therapy is a part of cosmetic gynec therapy. So after that PRP and FAT therapy, we have a lab in our own setup, we have a research center, and we have then transferred to the bone marrow derived stem cell, and then some different type of therapy also come. Nowadays a very useful future therapy is the exomers, we also be trying. So this is the history, and during that time we come across RCOG, we are basically prepared for on those days MRCOG, and during MRCOG treatment, although we have completed our MRCOG, we passed successfully part 1, and that time we have come across some book that there is a CO2 laser which is not useful for the gun or firing, it also in human being useful in the specific gynec, and in those days Family is the first one to start a CO2 laser, and from that day to this day we have a proper like evidence and paper that first is a Family from Alma, then there is a Mona Lisa, then this different type of in-mode person are coming, then this different type of laser, and different type of HIFM, HIFU, and latest is the plasma. So we have been old game player since 2012. So don't worry, we have all the proper channels, all the lasers with Indian made lasers, with foreigner lasers, with costing, with consent person and protocols. So don't worry, but you have to prepare one consent, and we have also that proper consent form is also available. So don't worry regarding, but you have to take a separate video or like photo consent in this type of patient. So apart from this, now which are the other complications? But less seen, we have not seen this type of complication because we take all proper precautions. This is a bacterial or fungal infection and reactivation of herpes. It is a cold source and it is not rare. But as per book, in India, we have seen so many patients with burn vagina. They cook like any vagina. The reason behind is that I will take just 2 minutes because I want to drink some water, and we will meet within 1 to 2 seconds. Hello. So what happened? There are 2 patients with burn vagina because some gynec want to prefer some cheap machine. So what is the market? The market is that there are basically 3 type of machine available. One is Chinese machine, which are not useful, or their government not allowed to use the Chinese machine on their own country. Second one is the Korean machine, and third one is the latest foreign machine like Photona or Plasma, etc. when you choose a cheap machine like Chinese or Korean, and we have and not many problem regarding their all company, but the problem is that the machine have not capacity to proper maintain the energy in a joule or heat generation. And as you know, when we put inside, if machine is generating more heat, then it cook vagina like a vegetable. So that is the problem, which is called the burn vagina. So now last point, it is the ethics in the cosmetic gynecology. So a market flooded with the so many like claim. So the claim basically is downtime, that there is no time, but definitely some downtime is there to recovery. From the some treatment is expected, and like any medical procedure, there are always possible risk. By ensuring you see a doctor or a clinic that follows the rules of the medical counseling, and naturally we are as an Indian, we have to follow the medical council of India or whatever the concerned regulated body. So first is don't claim any downtime, less downtime, or like some fantasy or fancy like claim. Second, you have to must follow all the protocols, all the regulation of your own country given by the medical counseling, and you must invest some money, also time in training, and highest quality technology means good machine that causes less risk are useful. And now the come to the point, training. So that's why we start this course, because all gynecologists who are attending this course are very busy. They are doing cesarean, they are doing gynec practice, obstetric practice, they are doing the laparoscopy, IVF, or huge OPD is going on. So it's not possible for any gynec to just go and expertise in this field, because they also don't know what is the right person. So for that purpose, we produce this workshop or a series of lecture which is properly practical and evidence based. And from when you start this lecture, from day 0 you can start your practice with as a cosmetic gynecology. So that's why this series of lecture is created. The benefit are, whenever you want to like show in the midnight or on Sunday, on festival day, you can. Second, what is the instrument? It may be computer, a laptop, or mobile, you can see, and you can also show your partner or a colleague or assistant. So that is the,
how many days of training are required to do gynae cosmetic?
okay. So that is very interesting question, and I will briefly describe regarding. There is no proper guideline how many days of training is required, and there are market flooded with so many type of claiming that they have a college, they have a falana type of grades, and college they make on air college and they create the grades, they give the fellowship as a name of some reputed institute. But believe me, please believe me, there is no any institute, there is no such college, no, there is no such degree in India. One thing is right, that as per AIMS Rishikesh has just started MCH in this reconstructive gynecology, and I think as per my knowledge, one postgraduate student has already passed this MCH in cosmetic gynecology. So otherwise all institutes are same, they are claiming to giving the certificate and degree and grades, but none of them are useful as a training purpose, or you are doing the practice for on the basis of that certificate. So I think during this time, as a busy practitioner, except you are a resident, you can just join this type of workshop and just go slowly, subtly by the one by one lecture, and clear all your doubts, and we can discuss live. And during I think 1 to 2 years is a learning curve, and make some minimal less complication. So as per my knowledge, there are so many like a person to claim, give the degree and grades. It is called this type of cosmetic grades. You are a grades of this institute, but fellowship there is nothing. Some USA board is also going on. They giving the, we are giving a degree of the USA board, but like there is no such board in India. Only a higher secondary education board and secondary education board. So don't believe, or like you are a like puppet of this type of institute. Okay, and these are the main thing that ethics you have to follow. Now, as you tell, this is the last some of the 1 to 2 slides that two biggest gimmicks of this field, these industries. First one is they are claiming we are giving 3 wavelengths diode laser 755, 808, 1064. So, as per our knowledge and our principle, is this possible? That we already know one laser, one wavelength, one chromophore. So how can it can be possible? So we have doing a lots of study. We have contact with so many industry person of different laser makers. Yes, they are claiming that we have a triple range, but as a gynecologist, I don't realize on all of them. So I just go through all the papers and all the whatever available on the offline and online, and then I come to know one right person from industry. He told me that, sir, believe it is not the triple wavelength, but a machine made by a company, they mimic, they intimate like this type of power they give, and so it's like mimic. It's a dog wearing a face of the lion. Same way, it's producing a faulty wavelength and they claiming for this triple diode. So this is the first one, and this is the description of that. It cannot possible. Second one, this is very important. As an Indian person and a Gujarati, when I come to know there is a laser of blue and green, I just remember Uri, and then there is a green light is coming from that side. But believe, my dear friends, as a gynecology, what I want to tell, that laser have a no light shadow. It is not visible. So in space, laser have a no beams or shadow, but a fumes creates, so dust particles scatter laser and make shadow. So first light beam and then laser start. So why I made this slide? Because when you use a diode laser, every slide has some meaning, but with a funny presentation. When you use the diode laser in your beginning practice, you have they claiming company that we have ablative and non-ablative both part. And when you use the ablative part, you enjoy a lot because you previously used the cautery and all this device, and this is a sharp cutter. So when you use that wire, you just put, not a touch, you just put in front of it, then the tissue cut, and at that time you see a beautiful purple or a green light. But this is for only making a target beam. That light is not a laser to show where your tissue is cut. So that's why they make a laser beam like color. Okay, so I think all these things are done for, I am also why I am present. Am I a good speaker, or my lecture is popular, or I am giving some secret? No. That is the part. It is the social media marketing in cosmetic gynecology and routine gynecology. Let's see. Oh, I become mad. So made this slide like desire, enjoyment, anand and charam sukh. This is not like any secret movie, but these are the word which is effective in any market, because every human being whosoever has a spinal cord, means higher one with higher intellectual, require only one thing. This is the anand in Hindi, enjoyment in English, and routine layman's bhasha, it is a charam sukh. So it is the bad word, though it is the bad word. And desire. Every people are like running or walking behind anand or desire. Say for example, you require money, that is desire, and you get the money, you get the anand. It may be a physical, it may be a social, it may be a family, it may be religious, it may be a spiritual, or it may be holistic. You are a trap of your mind and you want only anand, enjoyment. It may be a sexual. And this lecture is because of patient require improve their private parts, their intimacy. So that is the goal of any gynecology, to to give proper requirement to that person. So what happen when some person come to gynec OPD and they trying to ask something which he or she may be shy. At that time you don't offer them thumbs up, Pepsi, biscuit, samosa. They require some different type of anand, desire, enjoyment. So if anybody, it may be a Bill Gates, Mark Zuckerberg, Ambani sir, Adani sir, or me or you, is if you like, you get that desire of that patient, you get money or you get the fame. Let's see. So what is the marketing? Any activity which is profit earning. It may be a name, fame, money, social, whatsoever. So any activity which is profit earning. Profit may be different type. I have already explained. Now, if you want to become a successful and a money earning, which is not bad thing, you require a definition, some modification, desire, enjoyment, anand, charam sukh, creating activities which are profit earning, which is the goal of any laser cosmetic gynecologist. So, mantra is deliver what customer. Here customer is a patient. Must remember, it is not OPD where somebody come and Dr. Saab, take this good and take this doodh and take this nashta. They all are gone. All those days are now vanished. Now today is a patient is a client. So whenever you come to client, you have to properly judge it. So mantra is to deliver what customer want. Here woman is the customer or man is the customer, and cosmetic gynecology or a gynec or specialty hospital is a business. So otherwise we are not giving all the taxes. So for that purpose we have to accomplish the desire of the customer. And who is the expert person who fulfill the desire of the customer, he is become a multimillionaire. Okay. So question, but what you have to remember, don't do deceptive marketing. Deceptive means don't marketing. Say for example, you create a designer vagina, no. You make a Barbie vagina, no. You make a Barbie cosmetic, no. Or you give some stem cell therapy other than hemopathic stem cell, or say if you marketing wrong thing, bubble will ruptured in short time. And today's modern world, social media marketing is allowed in genie. So you rub it and in the form of mobile. So this jar is your jar and you just go through tuck 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 and you will get the money. So social media marketing in the form of the Facebook, Instagram, YouTube and everybody have a good website is must. 1 minute बाकी. 5 minutes we completed all the lectures. But some technical person, so our technical person is just claiming.
You can answer the question.
Yes.
Meanwhile,
Yes, yes.
the one question is, as per your practice, what is the overall commonest adverse effect of this procedure, sir?
As per none. As per if you are follow the
Tell the question also. Sir.
yeah, okay. Please tell me.
What are the commonest adverse effects in your practice?
What is the commonest adverse effect of the cosmetic gynec practice as per I understand. So as per my practice concern from 2012 as a regenerative surgeon, there is 0% like adverse effect of this science. If you purchase a best machine with a proper indication and you have a proper mentor like us, you don't trap after practice. So don't worry, it is the safest practice nowadays. There is no emergency. You get enough name and fame and also enough money. and so that's why you can prefer after 40, this is a preferable branch, and for newer one coming with like all the things faded, gynec, obstetric, laparoscopy, infertility, and fetal sonography. So now this is a rapid like busting branch, so don't worry, it is a 0% adverse effect.
Next question is, these lasers are very costly. How to
Yeah.
introduce in the
Yeah. I know it very well. So I am not coming with just show you all this jadoo, but we have also, there is a solution for that one. So you can later on just connect with us, because it is not possible me to like claiming anything in the in like this publicly. The rest assured, we are not giving you any razor or like anything else, and we can also not force you to purchase some cheaper machine, but we have a good option with a minimum amount and for good period of time with a like world based energy based device. So don't worry, I know it very well. Lastly, at the end of this session, everywhere they just ask, it is very costly, up to the 60 lakhs to the 1 crore 20 to 1 crore 40 lakhs. Don't worry, we also solution that. We will discuss later on, because in public we just started with this lecture and I want to just complete, because everybody knows it's almost 2 hours. So we have option for a good machine for a, only a penny price. Don't worry. And our number is 9727996444. So 9727996444. Am I right? Okay, so madam has written already the number, so you can later on discuss for this machine purchasing. So now these are the good option for the marketing, and believe me, social media marketing is the first number marketing. You get the lower to invest and higher to get. So please use this platform, but paid one. Don't try even to put repeatedly upload your slides. So ultimate goal is to provide anand, enjoyment, charam sukh, pleasure by the producing strong desire. For above all, you have to produce desire that title vagina, or like you have to give the result for the SUI, or you have to make a labioplasty, of course in indicated one. All above are maybe physical, psychological, mental, social, economical, spiritual, holistic, real or artificial. These are all the like desirement or charam sukh or pleasure. So if you fulfill patient these criteria like physical, psychological, mental, social, economical, spiritual, holistic or real or artificial, you can get enough fame, name and money. So don't worry. And with this is a very, in Hindi they told it's a punyashali paisa. So this is not paisa of high. Don't worry. This is your like you deserve for this one. So now ultimate, which is the Sanatan Dharma. Please remember, there is invisible giant system is running and we all are part of it. Here we are as Arjuna. Here the person, Lord Krishna, and show a Virat Swarupa. Virat Swarup means you even don't have a drashti, vision to show that we are only a like small part of it. And if you follow, Bhagavan Sri Krishna also told, if you fulfill desire of anybody, then you ultimately like go to the me. So that is the principle, that there is a big giant system is going on in the world or in the universe. All I think, what is the verse that if you follow the command, you will always get you want. This is the Vishwaswarup. You must remember. So please remember, in today's scenario, patient are the client or customer, and immortal mantra is if you give client, customer, patient what they want, which is here Anand, then you achieve anything. This is the final thing. Now, what is not marketing? So this is very important for the doctor. As a gynecology, what we are doing as a marketing, it is the camp, free consultation, at a low charge, or a free surgery, and we are giving the marketing for news, newspaper, television, on phone marketing. You can phone, pamphlet, hoardings, hospital publication, you put big banner on the hospital, media release, you do the tours, you visit OPDs, free or discounted rate, or you give the discounted or free medicine, or any reports, social programs, voluntary in some organ. You also give some social voluntary your sevas to all the persons. So these are all not the marketing. Please remember. So what they are? This is only public relation activities. You can only achieve some proper channel, so everybody know you, but you cannot earn money or fame from this type of activities. So even in starting practice you can do, but later on don't do, you can get anything. So ultimately marketing is developing desire and then do all these things. Market. So what is the real marketing as per my knowledge? One thing you know, that you fulfill the patient desire. Market assessment is first thing. New services you have to enter, from obstetric to CS, CS to laparoscopy, laparoscopy to IVF, and now come to the laser cosmetic. This is the new services development. Then market research. You have to research from social media or website or concerned person, what is the trend in the person. Is there laser? Yes, laser is now trending. Then evaluating the needs, that what I supposed to repeatedly tell you, evaluate the needs of the patient and what service or what management they require. Okay, so that is the thing, because after all us want to develop a new business. So every time you cannot fix one business, like you are doing delivery, so some computer come with you. So always develop this type. These are all the real marketing, and previous one is not marketing, it is only public relation. Actually, why we all gather here today? Basically, everybody know, to earn the money and fame, and to earn money from the right way is a good thing, and nobody of us must ashamed of it, but bravely try it. Because patient always tell, Doctor Sahib, you want only money. Yes, I deserve it. Why? First of all, our mother and father is invest so many time, payment. Second thing, no branch in the world in which a graduate pass after 28, 32, even 37 years. So till you don't get, so we deserve. We spend our time, we spend our intellect, our intelligence. So many person will help us, like our brother, our sister, mother, father, our wife, and even our children. Because all we get on Sunday, we spend 2 hours, so we deserve. So don't ever ashamed of when patient or somebody is claimed that you are practiced only for money. Everybody in this world is some try to earn money in right way. But yeah, that is the most common. There is a very right thing that we earn right money. So we decide we'll introduce a full cosmetic gynecology course, because we want to earn a good reputation, a good money, and we also give a principle of secret principle of this practice, and you become also successful like us. So we will introduce full cosmetic gynec course, including all topics. Which are the topics? All type of lasering gynecology, EBD, all EBD, commercial laser based machine list and contact number, electromagnetic device, HIFU, MIFU, Botox, vaginismus, vulvodyneal, Leber syndrome, PRP, gynec pills, gynec threads. Must remember, these gynec pills, gynec thread and Botox, first time ever we give a practical protocol, which type of instrument, which thing is required, we first time come with detailing. So please attend this. This is the newer one. Now labioplasty, non-surgical, labioplasty surgical, hymenoplasty surgical, fillers in vulva, in mons pubis and majora. We are now using fillers. Even you don't think, we filler different type of fillers and very good effect. Okay. So vaginoplasty surgical, non-surgical, exosmers, this is a newer trending. You can use exosmer. Even you think what is exosmer, we give a full lecture of 1 hour. What are different type of marketing available with exosmers in gynec, in cosmetic and infertility. In male fertility, we also give this exosmer, and don't require a, now stem cell and autologous fat, they are old, like old one. Scar and stretch marks, this is a routine gynec practice. P repair and mons plasty and labial major surgery. And lastly, After completing all about 10 to 12 topics, we just go to the basics, because we have to also learn the basics. So we also will teach you anatomy and applied anatomy for the cosmetic gynecology, newer training cosmetic gynecology every month. Social media marketing, this is a part of only. We have a very good like number of knowledge and slides for how to become a good doctor, a successful like money earning doctor and a fame earning doctor. So that is the social media marketing for cosmetic gynecology. What is the medical as a LLB, as a like a barrister? I also advocate some medical aspect of the cosmetic gynecology, some consent or photo and all etc. And yes, of course ethics, because we require right money in cosmetic gynecology. All contact numbers and details of the commercial companies selling cosmetic gynecology product and machines. What are the ethical? What is verified? And what is the like our CRRF verified person? So we can also give. And researcher, we have no any commission or cuts on this machine. We are only available from this platform, because every time doctor, because this is last one, huh? So every time doctor are like going here and there, they have to book flights, train, buses. They have to spend 2 or 3 days minimum to go there and stop their practice. So there is a big loss. Second one, they have to eat anything in hotels or like whatever, like they have to spend nights and nights for flying and training. And this one, this create the mental trauma, and also a large, a huge amount of money, like it's more than 3 lakhs, 2 lakhs, 5 lakhs, and at the end of these courses we cannot achieve. So we prepare a specific module, nothing will outside it, and we provide almost all the things, starting from principle, anatomy, physiology to the real practice protocol, how to do it, what are the complication, what are the number, different number, Indian scenario, abroad, and what is the cost. And yes, last one, there is a question, the machine are very costly, so how can we get a best one at the reasonable charge? That also we will tell you. So that all including this workshop, and it's take over period of 1 year. We will try that as a busy practitioner. We will do 1 to 2 lecture at every month, and then your doubt solving and researcher will give all the things. Like if you want to start a practice of pill for whitening of private parts, we'll give all the pills and what is the protocol we'll give. Second, how to do threading and how to do PRP. PRP is a very good thing if you give in proper manner. It is like genie of Alauddin. And then also which are the laser machine, because one thing you have to know, if you want to buy a motor car, one thing really, you go at the Maruti, and one is your expectation, it is a Fortuner. But the principle behind all are same. It is automatic or like manual, same way. All the machine have same principle. But the company person will come and train you that this is the principle. If you want to do SUI, you have to put this energy, and this time you have to just in and out prop, and good machine will always give the effect and protocols. So for a energy device machine, researcher will give you all the option. It may be a radio frequency, high fame, HIFU, carboxytherapy, plasma, newer one. No one tell you. Yes, we will tell you plasma. And last one, what are different type of laser. You just want to beginner or like you want to use this machine, we can also provide all the details. Second one, all the techniques, labia majora, labia minora, hymen therapy, PRP, newer pills, all thing including in this time. And the time duration is minimum is 1 year, and then after it is costing a minimum amount. Think what amount you think, and we have given you a number. Can you please tell me the number? 97 27 99 46. Repeat, 97 27 99 4644. This is the number. You can ask anything for to joining this course, and we'll give enough time. All the like PPT and videos will provide. All the customers and all the things will be provided by us and researcher. And I give you 100% guarantee that you get 100% satisfaction. And it's not gimmicks. It is made by Bharatiya doctor and made for Bharatiya doctors, specifically gynecologists. So I will not like promote any brand or like anything. But if you go through this all the videos and the live session discussion, and definitely you can start immediately from tomorrow onward the practice. That is my guarantee and my promise. And with you can also like get some good number of licenses with Dr. ALPA also. So that is the whole thing. We complete all the topics, and I give, as I promise, I give all this thing. And it may be possible you cannot join me later on because of some amount which required as a guru and shishya, as a mentor and also a student, that in our Gita ji also written that whenever you give something, you have to take something from your student. So as a part, we will take a minimum amount.
Question is, any post-training guidance?
Yeah, we will give the mentorship for 1 year. That definitely. And then you want to extend, it's a minimum amount. That thing that if we are give you this whole training, all topics, not coming anything, and if anything come new, like is come from the European society or American, we will discuss with you. But after 1 year, your subscription is end, then it's a minimum amount. Like I think, what do you think? I think it is a 5 or 10,000 minimum. It's okay. And what is your subscription price? What do you think? I think it's maybe a 1 lakh? No. 90? No. 60? No. Even 50? No, no, no. At your doorstep, we will provide a minimum amount. Guess, we'll later talk on. If you are really interested, you want to become a real laser cosmetic gynecology, please come contact on 9727994644, and we will provide as a mentor, me and ALPA, for 1 year. Yes, definitely. Anything else want to ask? So, thank you so much for patiently and very calmly hearing me. And it's my great pleasure to join this course, and will repeatedly this type of will create this type of seminar after weekly or monthly. But laser is definitely training. You must try it, and with good mentor and with good machine, good protocols, and we always ready to help you with a very minimum registration fee, and we also mentor you. So this is Sunday, so enjoy, go outside, and Jai Hind, Jai Bharat, Vande Mataram. I also, this is contact details. Contact details is joining course is mobile number is 9727994644. This is same WhatsApp number. You can contact in this number. Okay. And lastly, as a Bharatiya, Jai Hind, Jai Bharat, Vande Mataram, Bharat Mata ki Jai, and be a genuine, noble doctor, but never ashamed of earning money or fame, and always try newer one. It is a newer one. You can try. Jai Hind.